Some hospitals in states where coronavirus cases are surging are now running out of beds, and many doctors and nurses who watched COVID-19 hit the New York City area very hard are now concerned about what's next for their communities. Our senior medical correspondent, Dr. Tara Narula, spoke to frontline medical workers in California, Texas, Alabama, and Florida about their fears.
We started out a few weeks ago with around 130 patients, and it's gone up to about 370, 380 patients in the last 2 weeks.
Were you prepared?
We were. We had what I like to call the gift of time.
I remember really distinctly when the outbreak happened in New York City, we were all in our ERs down here in Texas. We started preparing. We started gathering PPE, and we were waiting for a front that we felt would come, and then wham, it hit after Memorial Day.
We're very stressed. I've never seen surges like this. I've never seen this many this critical, this many patients this critical. I've never seen the nurses work so much overtime.
You think maybe, okay, it'll start to trend downward, but then you get a new set of numbers the next day and they're either steady or they're increasing.
What are you hearing from some of your colleagues where you are at in California in terms of their level of concern or fear?
I think the real fear people have now is nobody wants to be in a situation where your resources are overwhelmed and you know there's things you could have done to help people and save their life or decrease their long-term complications.
You start to become a little more concerned and anxious every single day. When you have a little bit of, I can't find a bed for my ICU patient, or I can't find a bed for a patient who's admitted, that's when you start to feel a little bit of the pressure and the anxiety that, oh man, is this the tipping point?
I wear a mask 13, 14 hours a day. It's not that comfortable. It's much better than the alternative.
People that you know are thinking that masks don't matter and that coronavirus isn't real, or it's not as big of a problem as it is. It kind of hurts. Actually,
we know how to mitigate and decrease the harm, and that's by wearing masks. It's really kind of like not running a red light. I mean, we don't run a red light, so we don't get in an accident, and so we don't create an accident for other people.
It's very scary for all of us, but we have a passion. Nurses have a passion to care for people, and I think that's just kicking into overdrive.
This is seeming a lot more like a marathon, and it certainly takes a toll on everybody who's involved.
Normally I would get in the car after a shift, radio up loud, I'm happy to be off. Nowadays I ride home a lot of times in silence, just processing the things that I've seen. I just pray that I continue to be able to do what I do and help as many people as possible.
And Dr. Tara Narula joins us now. Dr. Narula, that's a powerful piece there. I remember in the early outbreak here in New York, medical workers were afraid of going home and infecting their families. Is that still a concern in these other states?
It is, Tony, and as you mentioned, it's been one of the biggest fears of healthcare workers throughout this pandemic. And you can imagine these are the individuals who've really borne witness to this tragedy, the fact that it doesn't discriminate. It kills the young, the old, that people have been dying in the ICU alone, having to say goodbye on an iPad. And that creates, as one doctor wrote, memories I wish I didn't have. And when doctors are in medical school, they put on that white coat and they take that oath, they know they're going to be sacrificing physically, emotionally, mentally for the rest of their life. But what they don't think they're going to have to do is sacrifice or jeopardize the health of their family and loved ones. And that is the impossible decision and choice that many of them find themselves in right now.
Yeah. Are there lessons, at least, that these other states can take from the experience here in New York?
Absolutely. And many of the doctors and healthcare workers we spoke to said that they had, as you saw in the piece, the gift of time and experience. Time to understand how this virus works, how to ventilate patients, what drugs might work, what kind of staffing and equipment they'll need. But many of them said that all of that time and experience only goes so far if you have a failure or a lack of leadership in your state or at the federal government level. If you have individuals who are not wearing masks and taking this seriously. We asked one doctor, what is one image that you wish people would remember? And she said, it's the fear in a patient's eyes when they're looking at me not knowing if the treatment intervention I'm going to give them is going to work. Imagine that that fear in that face is your mother, your sister, your child, your grandparent. Maybe then, she said, people will take this seriously.
All right, we can hope. Dr. Tara Narula, thank you very much.